First of all, I just want to apologize to everyone. I have a cold and I've been struggling with this cold for a couple of weeks now. So if my voice comes and goes, or if I have to cough at a moment's notice, I just want to apologize in advance because that may be. But nevertheless, I'm here. I'm excited to share with you a little bit about what I've learned on this journey of creating the ADAPT and leader models. And I'm hopeful that what I share with you today will be impactful for you in your work, and that if you feel it's something that you'd like to use, you feel free to reach out for resources. So I'll be talking today about a grassroots approach to change management. The idea about the ADAPT and leader model that I'll share with you is how to have a forward-facing format to help individuals understand their reactions to change and how they can embrace change more successfully. So for those of you who are not as familiar with change management, it is absolutely crucial in performance improvement and continuous improvement that you have change management as a consideration whenever you're initiating something new for staff with the way that they're going to engage in their work. So change management is pivotal to the effective performance improvement initiatives that you might be trying to roll out. And most of you probably know this, but that's why we're focusing on it today. You may have heard this quote before by George Bernard Shaw: "Those who cannot change their minds cannot change anything." And I love this quote. This maxim is powerful because it's true at every level of an organization. It's true for your executive leadership who are setting the vision. It's true for your middle management or who are helping to execute that vision down through policy and procedure throughout an org. And it's true for the individual worker on the front line who has to implement those new ways of doing something. Understanding how to embrace something new and change your mind about it is absolutely crucial to be successful in any sort of long-term mission for an org. So I think this sets a really good stage for the reason that we want to be thinking about change management and how crucial it is to include it in the work that we do. I'd like you to think about some of the most effective people that you personally know. And this can be on the professional level. This can be somebody that you know personally, but you kind of see how they show up in their world of work. Think about those individuals that you know that have a great ability to get things done, and not just anything done, but really important, useful initiatives and implementing changes that really matter. Think about those individuals and the characteristics that you know about them. Consider if these people are individuals who tend to be more concrete and rigid and structured in the way they approach a problem, or if they tend to be a little more flexible, adaptable, creative thinkers, willing to disrupt the way something has been done or the way they've thought about something to try to be more effective at implementing a solution. And what you might find as you're reviewing these people in your mind is that those individuals who tend to be the most effective in their roles, especially in a professional sense, are willing to reconsider information, are willing to reconsider their perceptions and how they come to conclusions and decisions. Oh, and I forgot to mention, if you have any questions, any comments at any time, please feel free to throw that in the chat. And I'm not watching the chat, but our lovely moderators are, so they will help interrupt me so we can answer questions as we go. So please feel free to do that at any time. So just a little bit about me. I work at Western State Hospital in the Civil Center, and I've been the Director of Organizational Change Management here for a couple of years now. Before that, I was working as a change management practitioner, supporting the split of the hospital into two distinct centers with two executive teams. And before that, I got my start here at Western in performance improvement with an amazing team that at the time was led by Matt Walters, is currently now led by Matt and Eric Lake, actually on the two different sides of the house. But they're a fantastic team here. Our performance improvement departments are awesome. They are probably the reason why I went into change management so enthusiastically, because we could see here that we had particular challenges in our environment that made it really challenging to implement change as we were rolling out projects and trying to make improvements. So it was pretty impactful and powerful for me in terms of career growth to have the experience here at the hospital. Before coming to Western, I was in private property management. I was in education and a small business owner for almost 2 decades. Okay, so I want you to think about yourself in your particular position in your organization. And ask yourself the questions that you see on the screen. Is this you, that your organization lacks resources and attention to manage big upcoming change? Do you feel like the proprietary change management language that you might be using is challenging and it's not necessarily understood or digested by your leadership and by the staff at your facilities? And when you think about the change management tools and resources that have been made available to you and that you try to use with your teams, do you ever feel like they are too cumbersome for your particular organization and circumstance? And I want to pause here because I really want to hear your experiences and your reactions to these questions before we go on. So I'm going to mute myself and wait for someone really brave to volunteer to answer one of these questions.
What happens in the COP stays in the COP. Feel free to unmute if you have an answer. I do see, oh yeah, go ahead.
Oh, well, this is Alexis. I'm from Department of Services for the Blind with the state of Washington. We're the vocational rehab counterpart to DVR, Department of Vocational Rehab. And I guess for me, I was trying to answer these questions in my mind, and I couldn't come with anything concrete, but I know that I got stumped on the third one because it talks about all the change management tools and resources you like to use are too cumbersome for your organization. I think that I think right now, as my position right now is I am a lead to our South region. So I'm all in the mix of changes and training and getting people to kind of get on board. And I don't necessarily have tools. There's not really like I guess I was excited about this because I was like, oh well, what tools are there? I mean, I think for myself and maybe I think for myself when I'm doing this, it's just like I just feel like I'm winging it and I'm just following along the project leader, but there's not really any tools. I guess it's just like, what are those tools? What would they be? Would it be something concrete? Would it be a list, or a way of making sure that we're all as leadership doing something to roll out or to make it easier for staff when it comes to change?
That was very well said. And I appreciate you sharing that because I think what you've described, many other people have experienced. And if you have experienced that, maybe give her a reaction in the Zoom room. Sort of give a hands up or a clap or however you want to do it. But yeah, I think that what you've described is very common. And we will talk about some tools today that you can use, and we'll talk about some ways to communicate with your staff that should hopefully make that easier for you. But really great contribution. Anybody else?
Kel, we have a few things in the chat.
Yeah.
So Jeremy said, I feel like this is true for every agency. Ron says, it feels like we lack consistent communication regarding changes in our organization. Jamie says there's an active resistance to change management at this time due to both a lack of understanding as well as a couple of less than successful attempts in the past. There's actually quite a few comments. Let me know if you ever want me to be if you want me to be quiet or continue reading, but there's some good comments in here.
I'm looking through. This is really
Yeah.
good. I'm noticing the note that yes, it is in general cumbersome to sorry, I'm scroll through this a bit. Being cumbersome in the process is also an issue. It can be a threat to the status quo of leadership. Jason, 1000% agree with that. And then the change management activity. Yes, thank you, Tennille. The change management activities come across as sugarcoating painful change. That's very well said. Yeah, these are really good contributions. Thank you. And thank you for reading those in the chat as well. So on my side of the house, what I would say being on the back end of it, where I'm structuring the change management framework and we're designing the strategy of how we're going to roll out information, how we're going to communicate with staff, how we're going to offer needed training and resources, all of that. It was pretty challenging because especially in state government, at times, your resources will be what your resources are, and it can be difficult to get more, right? And when I say resources, I mean money, I mean specific proprietary training, specific contractors that can come on with different initiatives that you're trying to roll out, additional FTEs if you need them. Like all of those things can be really challenging, but also people's time and attention just to get the bandwidth from people to engage in the conversation about this change that's coming up. So all of these things here on the screen, these are all things that we experience every day regularly where I work. And it's quite the challenge to be an effective change manager and to develop and execute a strategy that really offers robust support to your staff, because that's the whole purpose behind change management, right? Is supporting people as they're going through the change. Project management all day, you can outline what your needs are, you can schedule that, you can see exactly what your stakeholders need and how they're going to contribute. But the change management piece is really paying attention to the people affected and impacted. So I appreciate the examples that you've shared. I agree with everything I read and heard. And that has also been very much my experience. So knowing that was the experience, I wanted to think about how I could change our story here at the hospital and how we could make change more palatable, maybe even exciting, something that people could embrace with more success and less stress. That was the point for me as a change manager, help people to feel success and less stress as they're dealing with change. So this presentation, our story today, has 3 parts. The first is how we start out here at Western with a proprietary approach to change management. In the middle, we're going to talk a little bit about how we had to shift and tailor this approach so we could adapt to our circumstances and our environment, and how we ended up with our particular strategy going forward to engage our staff and make sure they are feeling the support that they need. So when we talk about the proprietary approach, I'm thinking of ProSize ADKAR, and most of you, if you have heard of change management, you are probably familiar with ADKAR. Most people who have at the first heard of this acronym are confused. What could this possibly mean? It sounds a little like maybe it's an alien race from Star Trek. What is ADKAR, right? So once you start to get familiar with it, you get the hang of how to use these steps, and we'll kind of walk through it just for a moment. So ADKAR, as you can see on the screen, is just basically these 5 main ingredients that are needed for change to be successful. And we talk about having an awareness around the need behind the change. People need to have a desire to participate in this change and bring support to the effort. People need to know how to do it. We need to give them information so they gain the knowledge necessary so that they can change. And then they develop over time some ability and some facility with the required changes so that the skills and behaviors they're exhibiting are supportive of the new way of doing business. And finally, reinforcement. So as you can see, ADKAR on the screen is simply an acronym to remember all those steps. And for me, I can tell you, like, conceptually, yes, this makes sense to me and I can get behind it. My education and my training in organizational psychology, this all makes sense 100%. But translating this to other people was really challenging for me. Does anybody have any thoughts they want to share about using ADKAR either now or in the past, and how that was helpful for them or frustrating for them? Go ahead and speak about it or put it in the chat too.
Yeah, Brian John here. We currently use ADKAR in my team and across the different projects we manage.
Mhm.
In SDCI, that's the Seattle Department of Construction and Inspections. And ADKAR provides a really good grounding framework to really get a healthy bird's eye view of whatever it is we're getting into. It kind of forces that. But there are a lot of challenges with some of the specifics, right? Depending on the maturity of the organization, also the human aspects, right? Like the maturity of the humans in the different positions, how well versed they are in that position, how well the positions are defined. There's a lot of things that happen, and that can make or break the right baseline to apply any of these principles, particularly ADKAR. So that's kind of what we're facing. We're beginning to realize that some of those foundational elements beyond ADKAR are kind of wonky. So navigating that space is difficult.
Thank you. Yeah, well said. And thank you. I see in the chat, Jessica, you had also mentioned that you do use ADKAR. It's successful. Folks understand it. They know how to use the language. It's common. So that is very helpful for you, which is awesome. And Shannon, with ADKAR, it's been helpful to get the sponsor executive commitment. Excellent. Excellent. Good. Yeah. Thank you, everybody, for being willing to share. It's so much more helpful to know kind of what your experiences have been like in some of this some of the models that are currently in place, because that can kind of help to facilitate the discussion of what's working really well and what's really challenging. For me, again, like on the backside of change, from structuring how we wanted to move forward, conceptually it worked in my mind really well. What we struggled with was the ability to roll out the knowledge of how to utilize ADKAR across different positions. And I'll talk a little bit more about that. So as a change management professional, I had the empirical support. I had the intuitive understanding of how ADKAR would work. It helped to make very clear for me what we needed as an org to be successful with the change. There's lots of tools and training and support offered through ProSci that I could use to help kind of describe to stakeholders of the project what this is and how we engage everybody who's going to be impacted by this change, and how we sufficiently prepare to make sure folks have communication and training and resources and reinforcement. So for me, that was really useful and very helpful. But what I found was, again, based on your resources, based on your funding, the amount of training and tools you can provide to staff is impacted. So at our level, we didn't have enough funding to have train the trainers and to give constant trainings to all of our staff about ADKAR and how to use it. And so where we got stuck was, we know what we need to do, but we can't really translate it for our staff to understand how they can help to manage what they're experiencing, both at like the middle management level and at the frontline staff level. So conceptually, I loved it. Practically, I felt very hampered, like I couldn't execute what I needed to execute. I couldn't get the information down to frontline staff and even middle management that I needed to get down because of training limitations and tool access limitations. So it was very, very challenging. So because of our circumstances here, I realized that we needed something different. And I realized that we weren't going to be successful in connecting the need for change and all the elements that folks needed to experience to do it successfully without a new adapted version of necessary elements for successful change. So basically what we did was I worked at looking at all of the different elements that are included in successful change. And I reviewed several different change models for this and put together a practical approach that was behaviorally based, that anybody could look and take this framework and say, I have this new change that I'm going through. What do I need to do to be successful at this change? And that is how ADAPT was born. So I did consult, just so everybody's aware, I did consult with ProSci on my approach here. I did consult with all of my performance improvement managers, continuous improvement managers, and my performance improvement team as I was building this out. And this particular model came to be the solution because it was a way to explain to individuals, if you have a new change you're faced with, if you're struggling with any part of that, these are things you can do that will help you have success in adopting that change. And it was something, a word they know, ADAPT. All of the elements within ADAPT are something they can actually monitor within themselves in terms of measuring if they're doing it. So it became something very different from ADKAR. And after we developed this, what I felt like was needed at that point was to try to explain how they could track that behavioral based action that they could take, right? As they're engaging with the change and as they're seeing if they could be successful. So to walk you through this model, essentially, ADAPT, the first thing folks are doing is they are acknowledging. So they're required to do this. They're required to acknowledge information about this change, the where, the when, the why, the importance of the change. And as they go to acknowledge it, if they realize they don't have enough information or maybe any information, this is where they reach out. And we'll get into that more too a little bit in the future, but this is where they reach out to get that information, because if they don't know something's coming, but they know they're being expected to engage with it, then they can be empowered to say, hey, I actually don't have any information on this. I need to figure it out. The second step, the behavioral based step in the ADAPT model, is to decide. And this is very continuous improvement, very lean focused, because it's respect for the person, respecting and acknowledging that person gets to choose. They get to decide how their personal values are aligning with this particular change and the organizational values that are calling for that change. So you decide as a person, for you, why is this change congruent with who you are? How does it align with what's important to you? So you're actively engaged in considering the change. Third, people are asked to acquire the knowledge and the skills they're going to need to embrace the change. And again, if folks understand, oh, we have this new system coming in place, it starts in 2 months. I've received no information about it. I don't know how to enter the system. I don't know how to execute what I'm supposed to do within the system. Then that's something that they can actually be aware of, that, oh, I need to ask for help with this. I wasn't provided XYZ. I'm going to have to ask explicitly for XYZ so I can be successful in acquiring skills and knowledge. Fourth, we encourage folks to practice, because none of us will be perfect the first time we try something. I shouldn't say none, but most of us won't be, right? So most of us need to try something on and move through it to understand where there are learning gaps and where we need to spend more time to become more proficient. And last, of course, you'll remember in ADCAR, that was reinforcement, right? Last, we have track. So we're asking individuals to check in with themselves and track their performance and how they're embracing that change, how they're performing it in their daily work, and then celebrate when they're doing really well. So this ADAPT model is different in that it's respecting the person to recognize for themselves what they need to do individually and when they need to ask for more support if they're not getting it. I'm just going to pause for a second. I'm pretty sure I'm probably already over time, but Talia, do I have any questions on that?
Yeah, I actually did just see a question come in from Shannon. It says, what if you decide what you value is different than what the organization wants? So an example like predictive project management versus adaptive project management.
Excellent. That's a great question. And I would say there's a number of things you can do with that. First of all, if you notice that your value is different from your org's value, this can spur some really useful conversation within your work teams, so you can better understand why the value is different and look into maybe there's something about that org's decision that you're not really fully aware of. And there may be some common ground that you just didn't identify before. So this can spur really good conversations to improve understanding and perhaps alignment. On the other end of the spectrum, you may find that there's a change that comes into the workplace that is so very much against what you stand for and who you are, that you want to reconsider what you're doing in your career. And that's also okay, right? Because we're all professionals and we're all individuals, and we have to make those choices for ourselves that speak to our thriving personally and contributing to something that we really care about. And you're probably also going to find there are a lot of times that you can make a concession and say, well, this is not my favorite decision. It would not be my first choice, but it's not so far out of my value system that I can't get into it, that I can't find a way to embrace it and move through it. So I think there's like a spectrum of particular answers and responses, and no one of them is wrong. Really, it's about who you are as a person, what your priorities are, and how you want to show up professionally. So, but that's a great question.
There were a couple other questions that came in, and we are getting close to time. However, you have a Q&A for 10 minutes after 11:05, but if we're going to answer a couple questions right now, then maybe you can finish. So did you want me to pop those in right now, those couple questions?
Sure.
All right, so is ADAPT used to complement ADCAR, or did you just use it as the tool and method of choice?
Great question. So in our environment, using ADCAR with frontline staff is not useful. It's not helpful. So we don't use it with frontline staff. And also, to be honest, we don't have the resources to have enough trainers that we can actually use it within like contractual obligations. So while I can use ADCAR on the backside, I don't really use it forward facing with staff. We do use ADAPT forward facing. None of it contradicts each other. It's all very complementary. but it's just it's easier for staff to understand ADAPT and the leader model that we'll look at in just a minute, because they can see behaviorally what they need to do to be successful throughout a change. Hopefully that makes sense.
Awesome, thank you. And I'm actually gonna let you get through a few more slides because I know you
Okay.
got quite a few, and then we'll answer this afterwards, or ask the next one afterwards.
All right, the next model I wanted to share with you is called Leader. And if you are familiar with ProSci and EdCar, you are familiar with Clark. This is akin to the Clark model. But the difference here is that instead of talking about roles like the Clark model does, this talks about behaviors that leaders need to exhibit to provide adequate support for their staff. And as you can see here, we have leaders need to listen and learn from their direct reports about what they're experiencing, what are their needs, what are their emotions as they go through a change. They next need to equip them with tools, knowledge, resources, coaching, reassurance. So be that constant support for your staff to help make sure they have what they need so they can embrace this change. Leaders need to advise bi-directionally. They need to advise upper leadership about what's happening on the floor, and they need to advise the direct reports with information about how to improve their understanding of this particular change. This is like this bi-directional flow of communication that middle management is absolutely responsible to handle. So we can tailor communication, we can tailor how we're approaching a change on the leadership end, and we can ensure staff can give us their honest feedback on the floor staff end. Fourth, leaders need to demonstrate their ability to embrace the change as well. So leaders, go through that ADAPT model yourself and find out for you, what is it that you're struggling with, or where are you short on resources and attention? What can you do to further embrace walking the talk, right? So everybody can see you're doing it too, model for them. Fifth, of course, this is definitely lean focused. Empower your people, empower them to recognize and overcome personal barriers to change adoption. That's going to look different for everyone. This is where your connection to your direct reports matters so much. How well you know them, how much they trust you. Show them that you're actually here for them to help them feel more peace and more success as they go through the change, and less disruption and less stress. And then lastly, respect. So and I know this is something you already know, but managers know that each individual has their own particular way they're going to show up to this change. They're going to have their own response. They're going to have their own set of needs. So we're going to tailor for them how we support them. We're not going to just pass out the same handout with, hey, here's what you need to know about the change. I communicated, you're good. We're going to tailor how we communicate. We'll tailor how we show up with resources. We tailor how we offer needed training and coach as needed, so that each staff feels that adequate support. And I need a drink of. Okay, so we will skip over this portion because we don't have time, but I just want to share with you, this is probably the last thing I'll have time to share with you. So here at the hospital for change management, we have a very specific approach that we're taking. And this approach is because of our particular environment, the context that we work within. We have 24/7 staff working on wards caring for patients that have a really hard time reading daily news or attending any sort of meetings to get information, having a struggle going to like a monthly town hall or reading a newsletter. All these things are really hard for our staff that work on the wards. So our specific approach is acknowledging that, and we have this, basically it's a three-pronged approach with a specific messaging focus. So the three-pronged approach is we have our change management community of practice that we are developing right now, where we reach out to every department, every work team, and we have a representative from those departments and work teams attending a monthly community of practice for change management. And the focus of that community of practice is really about informal information sharing. So to that community of practice, every month, we will bring new information about important changes that are going on in the Civil Center. And then the individuals who attend organically, not in any sort of contrived way, feed that information to their work teams. And in those conversations that they're having very organically, they will bring back to the COP concerns and questions and things that aren't clear. And through that, we're going to make sure that those staff that can't read the news, can't go to town halls, they're still getting the information we need them to get, and we're hearing their concerns, which is really critical for us. Second piece is training. We've developed training for ADAPT and Leader, And we have that on 3 different levels. We have like very brief micro trainings for our executive team as they have very little time to attend lengthy trainings. We have training for our middle management, and we have training for all staff on the front lines. And it's done on a pull sort of schedule. So we're not pushing these out on any particular, every 2 weeks, every 4 months, whatever. It's when people sign up and we have a full enough class, then we offer it. Because that's just the environment that we have here. People have limited bandwidth. So we're waiting for when folks are ready and are asking for the information. Then we use that pull system to give it. And lastly, we have an overarching change management plan. So anytime major changes are coming to the Civil Center, we are tracking that. And we are using some of our fabulous performance improvement staff to help us facilitate change management plans for each one of those major changes that need that specific focus. But we're looking at this on a very broad level to understand we have limited resources and we can't give 1,000% robust change management to every single change coming our way, but we'll strategize those changes based on priority and urgency. And then again, lastly, for those 3 elements of our change management approach here at the Civil Center, our messaging is key. So as I mentioned before, we have daily news that goes out. We have our newsletter that we send to staff regularly. We have monthly town halls. We have quarterly leadership meet and greet meetings where we're going to the staff in every department throughout the hospital on all shifts. And we have all supervisors meetings as well. So these are some of the methods that we're using to communicate out. And I know, Talia, that I'm at time. So.
Oh, you're doing great. I know that you had a couple slides that just kind of show some visuals, like along
Sure.
with some of those things. So if you just want to run through that really quick, and then we'll just take whatever questions anyone has.
Yeah.
Yeah.
I'll get through these and then get to the one that you're talking about.
Mm-hmm. This is awesome.
Well, thanks. Oh, I'll just mention this too. If you have newsletters, this is something really useful that we started doing here. We started introducing the model and what it means and how it works in our newsletter. So one element at a time, we would introduce to staff what this looks like to kind of help raise awareness. Some of the tools that we have, and we are refining these tools now, but this is the current state. We have adapt analyses. So we're helping individuals and teams track where they are in the change. So we're looking at how well are you acknowledging a particular change, or where's your decision to engage with this change at? How much of the resources have you acquired? How practiced do you feel? In your progress tracking, what does that look like? Are you celebrating your success? So we have a couple of those tools here. You see one is for individuals and one is for teams, and this is for managers really to use as needed with their teams. We also have this adapt gap coaching tool, which helps our managers understand, like, if you're seeing particular challenges, here's how you can coach your staff through. After you've done these analyses, find your gaps, and here's what you can do to remediate those gaps. And lastly, this one is the most complex, but I love it the most. I'm trying to find a way to refine it down to make it a little more streamlined. This is a change success plan for people managers. And what this is, if you are a supervisor, you are either on the individual level or the team level, you are going through to identify concerns or barriers with a particular change. What adapt elements that you'll need to address to overcome those barriers. And once you know the elements you need to address, which success plan elements will you use? Are you going to communicate or train or coach or track to help overcome those particular barriers? And this particular tool, it's a couple pages long. It takes you all the way through how to develop individual success plans or team success plans when you're rolling out a particularly challenging change. So yeah, that is the one I wanted to make sure you saw. Any other questions for me?
Yeah, we just got thinking along the same lines, Chevy. We just got a question. Can you share those templates with us?
Yeah, so what I'll do, I have a team right now that I'm working with here at the hospital. And we are, as I said, going through some of these and making some refinements to them. So as soon as the refinements are made, I can share them with Talia, and thank you, Brett. And we can make sure to upload these so that you can grab them to use. Absolutely.
This was awesome. Killer presentation. I could have easily listened to another hour of this. Thank you so much.
Thank you.
All right. Let's see. Yes, I shall start my video. Thanks for the reminder, Teresa. Okay, that was so awesome. Thank you so much. And now we are going to continue moving right along. And we've got Jeremy Walker, the equity and analyst with the Department of Commerce. He will be sharing his presentation on using Lean DMADV for equity analysis and project implementation. This is going to be another jam-packed presentation of wonderful, useful information. So everyone strap in and get ready to absorb some more great information. Jeremy, take it away.
Now can you hear me?
We can, loud and clear.
Great. I'm going to move this over here. Well, thanks everybody. I am going to present a little bit on the DMADV approach. You have probably heard of DMAIC. This one is part of Lean Six Sigma project management. And before I get too much into the details of the presentation, I'd love for us to be able to run our poll just so that we can get a sense of what kind of things folks would like me to really take a little bit more time with and maybe run through a few other things. So you'll see on your DMADV poll there, several checkboxes. You can check as many as you'd like. And then when we close that poll, that'll inform me as to which areas you'd really like me to drill in and focus on. And maybe other areas I'll just skip through and you can take a look with the materials that have been shared.
Thank you, Jeremy, for this thoughtful poll. Oh, the numbers are still adjusting just a little.
All right.
Looks like we're staying consistently highest in how did you merge lean and equity work? And then our
Okay.
second highest is what is DMADV?
All right. Sounds good. Well, I'll get started then. So I'll start by answering the second most popular question, which is what is DMADV? And then we'll go into how I merged the equity approaches with the lean approach. And DMADV stands for define, measure, analyze, design, and validate. We'll get into that here in just a minute. But before I do anything else, I just want to say that one, I don't necessarily call myself an expert in equity, and I don't call myself an expert in lean, but I have had over 10 years of practice. I get a little weird when people say that I'm an expert at something because I still feel like I'm constantly learning. So please don't take this as like, this is the way that commerce does it, or this is the way that you have to do it. This is just one of many ways, is part of the community of practice here at Results Washington. So with that, so I'm going to be talking a little bit about the project itself, and that will help answer that question of how we merged and embedded equity into this work. So you'll be seeing a case study here with building community funds. That was the work that I did. And then with the actual process here. So there were really two goals that I was assigned when I started this project, which was to step up the engagement with Black, Indigenous, and people of color-led organizations and by and for-led organizations and tribal governments. And the second piece was really we wanted to expand the number of overall organizations to apply. The problem is we don't have a database of every single organization out there, short of the Secretary of State's office, but we don't necessarily have it broken down into that distinguished level of demographics. And so we had some basic questions that we needed to answer. So some of those were like, who and where are these organizations across Washington state? What are their barriers to applying? And do we need to create new tools? And the idea was like, yeah, I think we do need to create new tools in order to achieve these things. But how are we going to do that in a way that is in consensus with many of these communities and their leaders? So I'm going to jump ahead and give you the results of what this project was able to accomplish. So we were able to successfully develop a a piloted tool that identified over 38,000 organizations across Washington state. We were able to identify over 1,200 possibly BIPOC and BI-4-led organizations. And we were also able to map our existing grant awardees in terms of the intersectional lenses of the health disparities map, along with a bunch of other maps that we commonly use to help us strategically look at where can our very limited capacity teams go and talk about this grant so that we're increasing those numbers, those goals that I mentioned a moment ago. So how did we get there? Well, we had to start somewhere, and this is where I was most comfortable. I'm very comfortable with DMAIC as well, but what is DMADV? And as I mentioned before, it's define, measure, analyze, design, and verify. And I think something that's really important when we think about how do you embed and how do you integrate this equity work, there's a couple of really important pieces in lean overall. There's two that I think about all the time. One is, what are the customers critical to quality deliverables? And then going to the Gemba. And so by thinking about the customers critical to quality deliverables, that isn't necessarily our team. It's not necessarily the program staff. It's not necessarily the legislators. It's the people who are going to be impacted the most. And what we found is that our funding, while reaching many diverse communities, we could always do better. And so we needed to really identify who those customers were and how to engage with them. And so that really meant we needed to co-design this and get the voice of the customers of those organizations that I mentioned, the buy-in-for organizations, in order for us to develop something that's going to be better and more efficient and more streamlined. So for those of you who are very familiar with DMAIC and DMADV, this really breaks down the reasoning and the rationale. A couple things I want to call out are really around the team size and also what you're trying to do. So with DMAIC, you're usually working in very small teams of people, usually less than 7. With DMADV, you're working with much larger groups of people, right? The voice of the customer, it's many different communities. In our particular case, we worked with over 170 community leaders through a series of workshops and additional interactions in order to develop this tool. So we had a very large team, you could say. The other really important thing is we weren't really trying to do anything we weren't trying to do incremental change. We were trying to do evolutionary change, which is big change. And that really meant that we wanted to do preventive approaches as opposed to corrective approaches. So all of these give a good example of what the differences are between DMAIC and DMADV. So when do you use it? Well, as I mentioned before, you want to know if the process already exists for something or not, and if it's a big change. That's really it. Those are the two questions. If you're looking at, we need to build something new and it needs to be a big change, then use DMADV. If it's not, and you're like, we can continue to work this out and do process improvement because it already exists, then that's DMAIC. And that's why in a lot of lean practices, we really focus on DMAIC because we already have our processes set up. We already have our staff in place. We already have, the tools that we need, and we're just trying to improve them. As opposed to DMADV, where it's like, we don't even have this tool. We don't even know what it looks like. We don't even know who we need to go and talk to yet. So that's really the big difference between the two. If there's any slide, whenever I get questions about like, what did you do in this project and what all did you do? This is it. This is the one slide. And I will give you a pro tip, which is any principles, any framework, I highly advise you to break it down into a Kanban. That's just what this looks like. This is a Kanban. It breaks down all the different tools and activities that we had to do. Those that are highlighted in yellow, those are actual workshops with our customers, with the people who we had to work with to help develop the tool that would allow us to see all these different organizations across Washington state. So in DMADV, you have the define stage, which is similar to the DMAIC, right? But really it was about who and where is being impacted. So we wanted to step up the engagement with Black, Indigenous, people of color, led and by and for led organizations and tribes. So those were going to be our primary audience. Those were going to be the people we were going to center in this project. They're the folks that we wanted to engage with and co-create in this. Now, that doesn't mean that we don't have lots of other intersectionalities, right? We have people with disabilities. We have people who identify as LGBTQ+. We have lots of different intersectionalities. And I think that's really important to emphasize here, is that we had a lot of different people from all different backgrounds joining in and helping co-create this information and this tool. So then we had our by and for led definition, which is what this is what it was at the time of the project. We've had by and for led definitions change since then, but this is what we used when we were working with organizations. And we had our organizations, we surveyed them and said, do you identify with this or agree with this definition? And we had a 98% agreement on this, which was pretty surprising in some ways. The next piece in here, of course, in define, and this is really just good project management 101, regardless if you're doing lean or some other kind of project management style, is to have a project charter. Really understanding who the sponsor is, when you're going to get this work done, understanding the business need, the project scope, and the deliverables are all very important aspects of this information. So having a tool like this really helped me as a project manager to get the work done. Another piece in define that I think is unique in particular to government work and public service is really understanding what are the laws that you have to abide by or be aware of. And with the legislative cycle constantly changing things up, we get new legislation that comes in. So if HEAL had passed and had been implemented at the time of this work, I may not have had to go to the full extent of this, but here are some of the RCWs and executive orders that affected the project. Equity frameworks. So for those of you who are like, I want to see how you really embedded these equity frameworks, here is a list of some of the frameworks that I used and embedded into this in terms of the different areas along the project itself. So you've got environmental justice, which is really based on the HEAL work. You have the GARE Racial Equity Toolkit, which anyone can find online. It's publicly available. There's also targeted universalism. If you Google that, you'll find a 5-minute video on it that really dives deeply into what that is. There's also the data equity framework from We All Count, which was really helpful for me in looking and really scrutinizing some of the data. And then we have some other new stuff. So we have state agency HEAL teams, which I strongly encourage you to go and talk to your HEAL team if you're looking for embedding equity work with your lean work. And they're complementary. They're not opposed to one another. They're very complementary. And then there's also PAIR. So some of the design frameworks that we also incorporated in when doing these workshops were human-centered design, design thinking, user-centered design, and lean UX. And you can think, man, that's a lot. And if you ever did anything in your graduate program or in your bachelor's program, or maybe it was a really robust high school program, and they asked, what was your method? You might say mixed methods. You see that a lot in a lot of research. That's kind of what this is. But DMADV really helped me organize it and make sense of it and kind of handle what was a lot of the chaos when it came to like people saying, oh, you gotta use this framework and that framework and this framework. So that's really what this is. So with the data needed, there's nonprofits in Washington state, and we needed to have the physical address of the organization, not the individual, the organization. So this is publicly available data. And then the types of services offered, and some other information. But we, as any other project would say, we don't have all the available data. So we have gaps in our data that we needed to go out and create as well. So when you're scrutinizing your data, you really need to be thinking about both the quantitative and the qualitative data. And so one critical thing that's really important, especially when working with communities who have not typically been served by government, or are not being served by government, is that their information could be private and we could be making it very public. So it's very important to think, how is this data going to be used, and what security, what levels of data governance are you going to put into place so that it's not necessarily subject to public disclosure, and if it is, then there's some sort of informed consent. But these are a lot of the questions that we asked ourselves when putting together this list of data that we were going to be collecting. Another thing that we did is we developed some of these questions and principles with our 170 plus community leaders. And we came out with some of these principles, as you can see below. So we wanted it to be respectful. We needed outreach and engagement to break out by social groups and pay people for their lived experience. We wanted it to be accountable. And we wanted to make sure that when we're asking for data from these organizations, that the information being collected, it's not free. Someone has to go in and collect that data and stop doing something else that they were doing. And so that is another piece that's really important when thinking about this data collection. And really, what's the point of the data collection? So we didn't really need to know at the time, like how many of this kind of group are they serving? We really just needed basic information and for them to self-identify if they were a by and for organization. So when you're establishing a baseline, when you're doing your measurements, you're going to be asking your own questions. But in our particular situation, we wanted to know how many organizations currently work with the program and how many organizations self-identified as by and for organizations. So that was a really important step for us to understand what our reach is and how many organizations are where and what's funded and what hasn't been in the past. So having that really strong understanding of what your baseline is really important. And then identifying the possibilities. So one example is how many organizations exist that could use this program. And what we found was there's 38,000 organizations that could benefit from this funding. That's a lot of organizations that we didn't even know necessarily existed, which was pretty exciting. So with the qualitative workshops, and there's a lot of facilitation techniques that I don't have time to go over today, but I'd be happy to talk with folks if you have questions, is to identify what goes well with the program from the perspective of the different customers. And so those are going to be the successful grant applicants, the unsuccessful grant applicants, and the grant staff. They're going to have the best understanding of how the programs currently exist and what changes might need to be made. And then also better understanding those who have had no interaction at all, what could be useful in notifying them and helping them know that the program exists. So some of the things that I am still learning how to do best practices on is asynchronous communication spaces. And I think this is one area where if I could go back and like do a better job of it, it would be creating asynchronous communication spaces. So these would be, doing follow-ups, making those phone calls, having a consistent email communication out to the group that says, hey, this is where we are in the project. I think I did a pretty good job of that. But now that we have more advanced tools in our toolbox like Teams or Zoom, there's an opportunity to create more asynchronous communication that doesn't require everybody to hop on a call and to talk. And that's also good for people who are not more extroverted. So for folks who tend to lean more introverted, it allows folks to have some time to digest the materials, right? So I'm leaving all of this materials with everybody here today so that you have time to really go through and digest it. I'm just going through this pretty quickly due to time. So
Oh, Jeremy, I just want to
yes,
let you know you've got time. So this is good info. If you want to slow
okay.
down a little, you can. You've got time.
I will slow down. Um, so I think another really important piece to answer the question around how do we embed equity with the lean DMADV work is we had to develop some new tools. And in here, we needed to see how our survey questions were impacting the privacy of the organizations and individuals that we were collecting that information from. So we held a workshop where we identified all of the different pieces of information. And you can see that up here on the right-hand side, you've got name and email, phone number, all highlighted in yellow. And then on the left-hand side over here, we have these risks that our community groups identified as real risks, and then we gave it a score and a severity. So we developed this tool that allows us to see and quantify what those privacy impacts are and how we might mitigate them. And so in conversation with the people, with the customers, right? We were able to identify what might mitigate those things and what level of reduction may occur. And these are, you could argue, something arbitrary, but I'll also say that a lot of the privacy impact assessments that are 120 pages long, when you talk to experts, they're almost just as arbitrary. They just might be a little more specific in terms of the context that might fall into place. But this was a tool that was developed out of this project that allowed us to really make sure that the information was kept private, or that we were really limiting the questions and the data that we were collecting that was in agreement with those communities. So I want to talk a little bit about surveys, and I'm actually going through some work right now to deliver even better survey practices. I think something to know is, like, too often, and when you're really busy, you just want to do a quick survey to get the answers that you're looking for. But in order to do a survey correctly, it's very difficult to do. It's really hard because you have to consider all the other factors that goes into an equitable survey. For example, translation. Another one could be the way that the survey questions are being asked. Is it leading or is it biased in some way? So I think that's something that is a lot harder to do than is said. But here are just a few of those things that I think you should do when putting together your surveys under a DMADV approach, and really any survey. So avoid making surveys generalizable knowledge. I always cringe whenever I read a report that says, this is how everybody thinks in X. Not true. In fact, most surveys are not generalizable. They're just not. The population sizes that are surveyed are extremely small, and they're often not representative of an entire population. So be very careful when saying that information is generalizable to an entire population. Another one is focus surveys on specific audiences and disaggregate demographics where possible. So, disaggregate by race and ethnicity. That's almost a given in today's world, and I-200 doesn't stop you from doing that. And I'm not an attorney general, so, if the attorney general says don't do it, then don't do it. But still, disaggregating that data is going to be really informative to any kind of study that you're doing. And then translating your survey. And when I say study, I'm going to back up here. When I say study, I'm not necessarily talking about collegiate level research. I'm talking about just informing your co-design, right? Disaggregating that data is going to inform you how you're going to develop that program or that project or that outreach. Yeah, so translating your survey, and then always including an informed consent question. So this means they understand how this information is going to be used, that it could be publicly available. And if you have like open-ended questions, it's really important that you reinforce that you're not asking them to relive any kind of trauma. That's really important, right? Especially because I think open text questions, we assume good intentions, but oftentimes people may read into something when you're doing a survey question, and they may divulge information that's quite personal and potentially embarrassing to them. So having a little note there that says like, we're not asking you to relive any of your trauma, right? But feel free to give us feedback as to how this has impacted you, or this tool could be used to help you. And I think that's really important. Talia, do I have any questions in some of this stuff? Or are we good to keep going?
Not yet. Yeah, go ahead and keep going. I don't see any questions at the moment.
All right. So what did we end up doing with this? Well, we were really trying to better identify some of the strategies, and we mapped a lot of this information out, which allowed us to then see where our current activity and funding had been. So if you see these kind of like purplish white dots, you'll see that's where our funding is. If you see the golden plus signs, that's just every organization out there. And then if you see the purple dots, those were ones that either identified as by and for led in our survey, or we identified them through similar characteristics and through the titles of those organizations. So with that, we were able to see, wow, there is a lot more opportunities here to be funding organizations in the Vancouver area. So by having our team say, you know what, in terms of where we could be focusing some of our time and staff to go in person, going to the Gemba to talk with organizations about their funding, this is an area of very high interest. The layers here you can see are those that have an index of 7 through 10 on the health disparities map. So anything that lights up in that kind of brown color, those are the 7 through 10 index. And then I think the other piece in here is the design principles. So when designing, it really depends on the framework you choose. And I think this is really important. It's a bit of a discussion in the lean communities, whether or not lean is a framework or an approach. Based on what I've read, lean is an approach. It doesn't stick to any particular frameworks. In fact, it's a framework adapter, which is why I liked using DMADV to adapt all these different equity frameworks into the specific activities and actions. It doesn't mean much unless you build them with the communities you're trying to serve and you're operationalizing them. So it's great to go ahead and think about the different groups. In thinking about like human design work, you're often creating a person in your mind of who is going to be served. And that's really good and nice. Having someone from that community is much better. You're going to get better data, better co-creation by going ahead and working with those communities right there. And then also adapting the principles of frameworks or principles that are adopted by the legislators. So in this case, the environmental justice principles under the Environmental Justice Committee is really helpful. And these are the different principles here. So using an intersectional lens, focusing on racial equity and recognition of ways in which systemic racism leads to disproportional environmental impacts, meaningful engagement with impacted communities, self-determination is a core principle to tribal sovereignty, and operationalize these through accountability of staff, respect for communities and tribes, and transparency in information, communication, and decision-making. So it's a lot of different principles when you're thinking about it, but if you organize it in a DMADV approach and you're able to break that down into more achievable chunks, that is really the game changer in all of this work. Another framework that I did use and I integrated into this was thinking about it in terms of universal goals versus targeted activities. And so having an established universal goal, we want more people, we want more organizations to have this funding available, right? But having everyone have the availability and access to the funding may look different depending on the community. In some communities, it's already well known. And so having more virtual actions makes sense versus having people go in person to those communities because they're unaware of it and we need to build those relationships is something that is also needed. So it's not a one size fits all, and that's really what targeted universalism focuses on. And then we have the tools. So we had to figure out like what were the perspectives, what were the layers that we needed to incorporate. And so we generated a bunch of different layers in our Esri GIS tool that allows us to map this so that we can do a better job of strategizing and working with specific communities. So then we built the tool, right? And we were like, yeah, this is awesome. But we had one more step. We had to validate with our customers. We had to validate, did we hit the mark or did we miss it? And what new things might be popping up that we need to be careful about? And so with the strengths, the staff could now see where organizations exist. And it achieved that goal in many ways. Organizations got really excited about this as well because they felt seen. And in potentially future iterations, it might be available to them as well. There's also opportunities. So by including buy-in for organizations who are aware of the BCF funding, we increased our numbers by quite a bit. We actually saw an increase in inquiries for the Building Communities Fund by 300%. So that's a huge jump. And we doubled the number of buy-in for organizations from 40 to 80 in terms of those who are now aware of the program and have a relationship with staff. So that was pretty exciting too. In terms of weaknesses, right, the data is still imperfect. When I was going through and applying some of the analysis and techniques that we had developed, we had really only gotten through about 3% of the total database. So that 1,200 is really only representative of 3% of going through the much larger Secretary of State's data set. And then the threat, of course, is that it could be misused to drive decisions. And a lot of organizations were really concerned that this tool would be used to decide on who receives the grant. And it was agreed between community and staff that it would only be used for outreach and engagement, as opposed to deciding on who is receiving the awards. It was a way for our staff to go out into those communities and say, this is where we're going to use our limited capacity to meet with folks in person. And we're going to focus on these areas that have very high indices for the health disparities map. And we're also seeing a whole bunch of organizations that exist there, whether they're buy-in for or not. So that is everything. I know I went through that really fast, but I wanted to be conscientious of time. And I think the main thing when you're thinking of lean and equity work is thinking about the voice of the customer and who you're centering. That's it. That's the easiest and hardest part of it. How do you incorporate all of those customers who typically don't get heard? If you can center them as your voice of customer, then you're going to be a lot better at engaging and merging those equity aspects. And I'm going to stop sharing my screen.
That was so awesome and so needed with so much of the work we're doing now, right? Like really having to be intentional and thoughtful and incorporate equity in everything that we do. And I just love how you brought that leans lens to it and you made it so applicable in this arena that we all work in. Does anyone have any questions? This was such a important presentation that I hope you all are going to walk away with some golden nuggets to go and start implementing in the work that you do?
I did see one question from Alicia. She asked how long was this project?
Yeah.
And the project itself was actually built out over, so it was a portfolio of projects. We started with 5 projects, and this was one of them. It took about 9 months of that work, and about 60% of my staff time was dedicated to it. So it did take quite a bit of a lift, but I would also say that's part of the messiness of these projects. And when you get something from the legislators and you have to figure it out, right, it's just going to be a mess in terms of from the project standpoint. You try to make it less of a mess for everybody else, but if you're the project manager, if you're not okay with chaos, I really recommend a different job.
Thank you
you
for
so
that.
much.
Oh yeah, come on. You have another question?
No, I don't have another question. I just wanted to
Oh,
say thank you. It was a lot of information, good information at HCA. I mean, we're trying to embed the equity piece into the work that we're doing. So this was great presentation. I took a lot of screenshots. I'm just really impressed. Thank you.
awesome, Alicia. Thank you. So good to see you. Yeah, Jeremy, I'm totally going to go back and watch this again just to absorb and soak it in. So just a reminder to folks, we do have the materials on our website. So if you want to go back and listen to either presentation today, please feel free and do so. Any other questions?
I did get one more that was sent privately, and the
Okay.
question was, would you please shed more light on the nature of interactive questions you ask to your prospects? So when we asked those questions, one of the questions we asked about the data collection was, what is culturally appropriate when collecting data in your community? What does that look like to you? And then we stopped talking and we accepted the fact that there was going to be some awkward silence. And we also did it in a way where we used Mural as a tool to ask those questions, because a lot of people might not be leaning more on the extroverted side. And so what we had is we had like maybe 6 or 7 very talkative people, which was great talking, but we had over 100 people typing in Mural and putting that information up. So that was one of those examples. I see, Lillian, you have your hand up.
Yeah, as a coworker of Jeremy's who watched this project unfold and how I think I love Jeremy's charts, and his Darcy is out of this world, let me tell you. So detailed and so rich. And I think the joy of watching this project for me was how that detail evolved from community feedback. There was, of course, a base and a template that Jeremy would start with, but so many aspects of the project came from critical thinking that was a response to what community says is important. So if you ask, what are data collection methods, for example, clear questions about process, and Jeremy, you can tell me how this fits into the acronym that you have, but if you ask a question like that, not only should it show up in how you collect data, but how you store data, how you affect the entire project, because data collection is a major part of so many things. Could it also affect community engagement? Could it also affect dispersal of funds? And I saw that happening live so many times. And I just really appreciate and want to emphasize that when Jeremy's using this iterative and planning tool, every piece of data kind of goes through this process. It's not this very segmented linear thing that we only do reflection at a certain time. And moving back to the data that is most central, that equity method from the othering and belonging and targeted universalism, listening to that as the key voice, as opposed to all of the managers and experts internally that are fighting you via email, is just so helpful to you as a program manager. And it's something that, just as a teammate of Jeremy, having someone who shared that vision was so important. And so just want to emphasize, as well as you're managing the project, I found it really helpful to have a coworker to just lean on when we needed to ground ourselves in these equity processes. So I just want to share that Jeremy not only put it in his project, but he put it in relationship to other people around him as well, and sharing best practices like with other team members too. And that's, I think, is just as important as we try to build equity in systems, as we build it with each other. So the super side note is that Jeremy did a write-up of each one of these equity frameworks that was so gorgeous. So highly recommend, Jeremy, that you put that with the materials if it's not there already. But as someone who does well with text, it was really, really helpful, and explained how you implement an equity framework in this project very, very well. So just props to Jeremy and integrating this process.
Thank you, Lillian. Oh gosh, what such good feedback and perspective from someone that worked right alongside Jeremy on this project. This is, I don't know, it's kind of like a dream presentation in the sense that I've been looking for a presentation to bring to the COP that really details how to integrate equity in the lean work that we do. And you couldn't have hit it more spot on, Jeremy. So thank you again for this presentation. We do have a few more minutes before we close out. I don't know if anyone wants to share any projects that you're working on, or maybe you're working on something that might need to lean on something you learned today. If you want to share any of that, please feel free to take this time to do so. If you have any additional questions, maybe you heard something today that you want to go back and use, and you just have another burning question, now's the time to ask. No, any other comments? I'm really grateful for these messages, or for these presentations today. Love the emphasis on truly listening, Diana says. Thank you, Jeremy. Super valuable. A lot of good comments in here. I'd love to see that write-up, Jeremy. Yeah, so if you want to share that, we can include that in the materials and add that onto the site.
Talia, this is Teresa. I'm not sure if you can actually see the Q&A, but Larry had a question for Jeremy. So do we now have a data layer of by and for organizations in Washington?
Not yet. Nothing official. Something that I think would be, and it's a tad off topic, but it's incredibly relevant. So we do have more and more legislation that's coming up for by and for, which is incredibly exciting and very much needed. That also said, especially when we look into co-designing and co-creating with communities, there's also the lived experience work, right? And between those two, as of right now, there is no protections for those of us who are pass-through agencies like Commerce is, where you're not directly serving individuals. The protections that are typically there are not there. And so there's some needed changes to public disclosure that would make this so much better and easier for all of us, not just for us serving, but for those who we are serving. So that's part of the reason. It's not all the reason why it's not existing yet. But it's a tool, it's a prototype, it's not anything that is finalized. But if you want to create it yourself, it's pretty easy to do, to get it from the Secretary of State, and it's all publicly available information. So you're not dealing with like PI level 3 or anything like that.
Awesome. Thank you. Well, we are at 11:58. Thank you all for your time. Thank you so much, Kelly and Jeremy, for your time and all the work you put into these presentations. It was wonderful, and I promise I'm going to go back and listen to them again just to absorb it again. We will be sending out the blast recap, so everyone who is on our deal, which should be everyone in this community, be on the lookout. In a few days, we'll be sending that out. But other than that, you all have a wonderful week. See you next time.
Thank you.
Thank you. Have a
Thank
good week.
you.
Thanks.